What behaviors are signs of trauma, and how does it manifest itself at different ages?
Oh, big question. Well, for newborns, signs of trauma can certainly manifest in their inability to bond or attach, okay, to a caretaker. If you're looking at younger children, delays in their development, ability to walk, their neurological development and coordination, as well as their ability to sometimes speak. And then the social interaction tends to be somewhat stunted. There's not good eye contact sometimes with small babies who've been traumatized, or with young kids. There's a tendency for them not to be able to attend to the social dynamics in that way. As they get older, right, then you'll see this reflected in school and early grades in elementary, where there are behavioral problems, and there are problems with other children's kind of finding friends and socializing, difficulty paying attention, and also just at home for children who've been traumatized, they can sometimes experience difficulty sleeping, night terrors that they can have, difficulty really being comforted by the parents. So you may find children who will go into these periods where they're crying, okay, and it's very difficult to comfort them in that respect. And many times, if a parent hasn't learned some coping skills to regulate themselves, then that also just kind of contributes to the dysregulation of whatever the child is. Now, of course, going into later grades, by the time, from my experience, and I have grandkids as well, but from the time my experiences, when children are reading that middle school age, if they're not doing well, they tend sometimes to be labeled as problematic or developmentally challenged or emotionally challenged, and that further can not only stigmatize a child, but it can put them into the kind of situation where they're not part of what we consider the mainstream in a school, and they can be dealt with more from, I think, versus a kind of proactive, nurturing perspective. They're being dealt with from kind of a preventive and behavioral perspective. You know, there's going to be a problem in the classroom, so we need to control that behavior. Not so much what can we do to help that child thrive. So that's partially, I think there's some issues there in terms of the educational system, but going, of course, into high school, if they are traumatized, then there's a tendency for exposure to drugs, early involvement in sexual activity before they're really ready, dropping out of school, difficulty academically, encountering the legal system at times. There are kids, unfortunately, getting to the juvenile system, and they're, of course, you know, that's a horrible thought to think that you have to lock children up, but there are children who get incarcerated. And many times they're not successful academically, so they drop out of high school, they don't make it there, and that leads into a cycle where ultimately they may end up as an adult going into the prison system, encountering the judicial system. Their relationships suffer, of course, across the board, and their health suffers with that. And if there's not any support for a person by the time they become an adult, then it becomes very difficult for them to successfully master the life skills they need to be able to be successful as a person.